Hey, welcome to Boardroom to Backend, where we dive deep into the minds of top CIOs to uncover the strategies, principles, and decisions that drive technology and business transformation. I am Haricharan, a techno-functional strategist, a startup investor, and mentor, and I am excited to bring you honest conversations with the leaders shaping the future of IT. Today, I have the privilege of speaking with Michael Minks, CIO of BayMark Health Services. With over 25 years of experience in healthcare and IT, Michael has led high stakes technology transformations, optimized complex systems, and built IT strategies that power healthcare operations. From IT service management to large scale system implementations, he has been at the forefront of solving some of the biggest challenges in the industry. In this conversation, we'll explore his journey to the CIO role, his leadership philosophy, and the lessons he has learned along the way. Whether you are an aspiring tech leader, a business executive, or someone passionate about innovation in healthcare IT, this episode is packed with insights you won't want to miss. Let's get started. Uh, Michael, let's just kind of rewind and start from what was your childhood like, what experiences in your childhood perhaps shaped your interest towards technology or problem solving in general.
Yeah, so I grew up in the Midwest of the United States, Kansas and Nebraska. I was always the kid that was taking stuff apart to see how it worked, and I had the luxury or the benefit of growing up around, particularly the men in my life who were machinists and were engineers and were people who knew how to fix things, and they were patient enough to teach me. And so they taught me to think through how to solve a problem or fix a problem rather than just replace a thing or replace a system. And so very early on, it helped me kind of get confidence that I could solve problems and get comfortable with the idea that problems are solvable. And so that was a big influence on me. I also had supportive parents that they really never put any limits on me. They never said, "Oh, you shouldn't do that," or "You can't do that." It was very much whatever you do, try to do your best, but try everything, try to figure it out. And so I was just blessed with that ability to have a broad mind. I tell people I'm probably an inch deep and a mile wide. I know a lot of things, or I know a little bit about a lot of things, but that helps me with a perspective. That's how I kind of learn to learn. And so when you can take solutions or take ideas from different domains and put them together, it sometimes creates really interesting solutions.
That's great. I think that's a great beginning for somebody to, start off in the journey. So early on in your career, when you started off, like what were some of the influences that are still shaping your decisions today?
I've always thought, because I didn't actually go to school for IT. My undergrad was in broadcast journalism. I wanted to be the guy in the truck. I wanted to be a technical director.
Okay.
And so I always loved the technology, and I really got into it because it made the switch from analog editing to digital. I became more interested in the computer. But I always think about things from their value perspective instead of their technological capabilities perspective. I tell people there's no such thing as an IT project. Even a pure infrastructure project is there for a business purpose, and you have to be focused on that and seeing how are your IT solutions amplifying the business around you and providing unique solutions or stable solutions for that. And so having that little bit different background has really helped me think differently about IT. I also can communicate differently. When you're trained as a journalist, at least in the United States, you're trained to write for a sixth grade education level. You're trained to take very complex topics and break them down into 30-second sound bites. We kind of hate that about our news right now, but it's a useful skill in the boardroom where you have limited time, limited attention, and maybe not as much experience or exposure as you would hope. And so to take something that's very complicated and very business risky and make it to where senior business leaders can understand it quickly and make a decision, it builds trust. It builds the way that's how you connect with your peers and not just become the IT guy. You're actually getting solicited for, hey, do you think this will work? Do you think this is a good idea? Is there a different way? And that's where IT really shines. That's where when we bring in technology platforms, it's less about I can do a certain thing. It's more about we can achieve a certain outcome.
Awesome, awesome. So, along your path of this 25 years, I'm sure you have seen a lot of stuff that has shaped your career into take the CIO role. So, was there one defining moment that you would say that hey, that actually has been very pivotal in where you are today?
It would be difficult to say one moment. Unlike most CIOs, I started out on the infrastructure side of the house. I was a PC tech as my first technology job, and my first healthcare was a network engineer and security person. And so I don't really think about things like application analysts and application developers do. I think one of the more pivotal moments in my career actually happened not that long ago, where as part of a transformation at one of the health systems I worked for, I was given operational responsibility for a unit. So I was running the contact center for scheduling, for nurse triage, for some of the out-of-band patient monitoring. And so I had operational responsibilities for care delivery and for care coordination. And that really made me think differently about my IT partners. When I became the customer of IT, it absolutely changed how I think about engaging as now an IT leader back on the technology side of the house, and asking different types of questions and understanding the root processes more than the conceptual idea of a schedule. What are the processes that get a patient from a phone call to a doctor's bed and get a bill dropped? And so that has made a huge difference. I would say any technology aspiring leader, any leader, if you can get, even if it's a year or 6 months operational responsibility, maybe even intern yourself into your own company of, hey, I'm going to go intern in the contact center or in the accounting department. Learn those businesses and see how they use IT, and you'll be a much more effective IT leader after that.
Yeah, I think that's a great insight there. To take an operational role and being an intern in your own organization, I think that hands-on experience is what probably makes you an effective leader there, right? So, I'm
Right.
sure. See, when you are looking at such a large journey, and given technology and the nature of the technology, there are bound to be certain failures or setbacks, right? So that we all experience. It is not very uncommon. So, what are some of the failures or setbacks that you perhaps have experienced, and how has it kind of shaped your own thought process today?
That's an interesting question. One of the things there's a couple things. I think I read a statistic that like 75% of IT projects fail. Like they don't achieve their business value. They never complete, which is more likely. They never make it out of pilot because we don't manage the organizational change management side. And so for me, a project that really sticks out is we had developed and found a clinical scheduling system that would allow kind of self-service, almost like you can do to your auto body shop or your car service, where you can go online, you can find a slot that works for you, you can drop yourself on. It met the physician's needs, it met the patient's need, it was cheaper, it was more effective. It actually improved revenue, it improved throughput, and it was thoroughly rejected by the business. It made every part of the business better, and they rejected it outright. And that's what I really learned, that having the better idea isn't always going to get you where you need to go. You've got to manage the organizational change management, the social engineering, if you will, in IT speak, of getting people on board, either helping them identify the problem you see or attacking it from a problem that they see to help you get your solution. I had an old boss that said, do you want to be right or do you want to get things done? And so I very much focus on getting things done. But that was one where it's like I clearly had the better solution. and they just were not open to discussing it because the risk of change was too high for them emotionally to see the value, the benefit, the business benefit of the change. And so that's really changed my focus. Everything that we do around system change, even down to rebooting servers and negotiating maintenance windows, is organizational change management. How do I see help you see what's in it for you? What's the benefit to the whole organization so I can get done what I need to get done? And that was a very powerful and painful lesson, because when you're pure technologist, when you're just like, this is clearly measurably the better thing to do, and they still reject it, logic flies out the window at that point.
Yeah. No, I think that's a very valuable lesson, that what you shared. Like, it is more important to kind of get things done rather than proving you to be the right person there.
Right.
That's really good. And who are some of the biggest mentors in your career journey who have actually taught you some of the tricks of the trade that are needed for you to be successful?
Yeah, I've had leaders all along, and I was lucky enough. It's interesting in my career trajectory. I went to work for a hospital that outsourced their IT to Perot systems, and I was not a very good transitionee. I was not a very pleasant person to transition. But once I made it into Perot system, I was exposed to technology and business leaders that I had never experienced before. Very powerful men and women who really knew how to do things. And so some of my early leaders at Perot, they would, even with the beginnings of how are we tracking work and making sure we're getting done what we promised to do, just that basic service delivery and that basic service tracking. And then a guy named Bill Smith that I worked for at Perot gave me a chance. He put me into some kind of mid-level executive roles and taught me how to present a budget, present a P&L to the business. When things were bad, he would take the lead, and I would be there beside him. When things were good, he would let me take the lead and get exposure to the executives and learn how to present, and we would practice and talk things through. And so those were the very important formative functions for me becoming a better executive. And then also just realizing at some point you have to if you want to be a CIO, if you want to be a technology executive, you're going to have to let go of being a technologist and stop fixing PCs, stop being the guy that jumps up in the boardroom to fix the projector, right? You've got to be the executive in the room. And then, really I get kind of down the path. There was a guy at Ascension that I worked for named Jerry Lewis, who gave me my first real big CIO role in Austin, and gave me enough room to make mistakes. He was firm enough when I made mistakes that he corrected the behavior, but he also wasn't punitive. He wasn't going to take you out because you made a mistake. And so I learned from that, and I learned how to support people in a way that lets them take chances without the stakes being so high. And in healthcare, if we mess up, people can die, right? I'm not being hyperbolic about that, but there are places where you can take chances, you can try things, you can let people try to grow. And so I've tried to model those behaviors and let my people spread their wings, try new things. And when you trust your people and you let them use their creativity, you almost always get a better solution out of the end versus me telling them how to do it.
Awesome. I think that's really important. And how has your own leadership philosophy evolved over a period of time? Right?
Yeah.
A lot of things have changed.
Yeah, I very much began my career command and control. It's like, okay, just keep the troops moving. As I've matured and as I've grown in my professional career and been around and been exposed to other leaders, I have realized that my job is to remove barriers and provide growth, give people opportunities to grow their careers and get new experiences, and then also guide, try to eliminate as many barriers as possible to getting things done. As I've moved into a smaller organization that runs differently, my role has kind of changed. I'm actually maybe a little more hands-on than I would like, but I'm spending a lot more time coaching people through how to have conversations, how to be more politically aware, how to be more astute as to what's going on around you, so you can get your ideas across, and starting to do more of that coaching. That my job now is to make people better, not to make people do things, and so that's something I've really embraced and tried to focus on. I don't always succeed at it. Sometimes I'm just like, go do it. I told you to do it. But there's also a time and a place for that. As a leader, you have to know when that's appropriate. But that's my thing now is really being a person that provides growth, provides areas of opportunity, and helps people become successful with me, but also in their career.
Great. Now shifting more towards some of your operating principles, right? Like, what are some of the key principles that you use on a daily basis when you're functioning as a CIO?
They're platitudes, right? They're the ones we've all heard, but what gets measured gets done. If you're not watching your metrics, you're going to drift. If you're not tracking projects and holding people accountable, the projects are going to delay. I'm a big believer also in Parkinson's law that work expands to the time allocated to it. So if you give somebody a month to do something, they're going to take a month. Whether that task takes 4 hours or a week, you're going to take a month. And so I try to really keep things moving on time. The other thing that I've really been thinking about recently, because we're a very small IT department in a mid-sized company, we're pulled in a lot of different directions, and I'm shifting into a philosophy of we need to do less things faster in order to get more done. So doing 50 things a little bit every day, everything gets done in a year. If we do 3 things really well for a week, we get 50 things done in a year. And we deliver a lot more value earlier on in the value cycle. So that's my philosophy at this point. And with the company I'm in, we're not necessarily doing a lot of really cutting edge innovation at this point. It's much more around operations and efficiency and effectiveness. And so that's my focus. Now, if I were at a big, well-funded health system that was really trying to manage taking patient share away from their competitors through better technologies, better experiences, better facilities, it would be a different approach. But for where I'm at now, it's all about are we doing what we said we were going to do? Are we doing it as quickly as we can without doing death marches every day? And are we generating value out of those projects? Are we doing them because they're important, or are we doing them because somebody thought it was neat 6 months ago and we never stopped working on it? That's the other part of being a leader is what you stop is just as important as what you start.
Wow, that's great lesson. And so, unlike other leadership roles, we are in the technology landscape, right? And where there is continuous innovation that is happening. And as you said, like, your context in the healthcare is slightly different than the other healthcare providers, right? So, given all that, how do you actually balance innovation versus stability, right? So you do need innovation because you can't be stagnated in the technology space, because that's a great value driver for your business. So how do you actually balance between these two?
For me, the innovation, so I try to read and keep up on as much technology as I can, at least at a superficial level, to understand what the concepts and the constructs are, so that if I hear of a problem, or if I hear of an idea, I hear of something that needs to be done, I'll have an idea of the tools that might be available. I may not know exactly how it works, but I'll know that it's available, and I can go find partners that do know exactly how it works. But then once you evaluate that, it has to generate value. Especially in small companies, there's no innovation for innovation's sake. So the things we're working on are, one of our key metrics is keeping people in program. If I can keep them in program for 90 days, I can keep them sober for a year. So what kind of technology and innovation can we use around patient engagement, around AI, around content delivery that help people stay in program longer? Those are the types of innovations we're going after. A lot of people in healthcare, I know we're kind of all tired of hearing about AI, but within healthcare, there's dozens of applications for AI. that generate direct value from automatically reviewing claims so that they go through to the insurance company much faster and much cleaner, to having listeners with your physician so they can see more patients more effectively and more accurately, getting accurate notes. Things like on the behavioral side, where the AI will pick up on cues or patterns that the human counselor may not have picked up on. And any of these technologies that lets us move the caregiver's focus back to the patient instead of looking at the technology has got to be good for us as humans. So that's where I try to look at it and say, okay, what is the benefit? Now, in our current environment and in our current economic environment, it's going to have to pay for itself and pay for itself quickly. We don't have a skunk works, but there are places we can apply it and do things effectively and pilot quickly, fail quickly, and then decide what works.
Sure, great. No, I do want to kind of delve deeper into the AI aspect, probably, but much later in the conversation. But for now, I would like to kind of go a little more into this aspect of some of these things like AI or even other new technologies that are coming, and you'll have to kind of take some amount of risk. So there are places where you have to take risks, some places where you have to play safe, right? And given that it is healthcare, you're dealing with patient data and all aspects of it, what are those areas where you potentially do take risks, or like what are those areas where you have to kind of play safe for?
Yeah, I'm probably the worst guy to ask because I am so risk averse. I am a very play it safe kind of guy. It's a valid question though, because you can't just live in a bubble. You can't just play defense all the time. Where I'll look at taking risks is where the operational or the financial risk is controllable. If we're going to apply looking at claims ingestion or claims creation technologies that let us go faster and are more accurate, I'm not going to just deploy that to the whole world. I'm gonna siphon off, or I'm going to segregate off a few clinics and try that out with operators that know what they're doing and can identify problems quickly. One of the things we're piloting is Copilot from Microsoft. I'm concerned about what it can do uncontrolled. So we've got a handful of very technology savvy users that have already high exposure to the data in our system. So if they see something they're not supposed to see, it's not going to be catastrophic. And we can test it out and see where things pop and what we need to do to test it. So I am very risk averse, but I also understand that there are ways to test technology, test innovation, and do it in a way that you're not going to bet the whole company on it, or do it in a way that's going to expose things that shouldn't be exposed.
Got it. And so when you do make some high stakes decision, right? So you rely on the data, facts, or like is it intuition that has been built over long experience of more than 2 decades? What is that you use, or is it a mix of both?
It's a mix of both. I have been around leaders who will die from paralysis by analysis. There's always one more piece of information that they need to make a decision, and you never make a decision. I've also been around leaders that were shoot from the hip, and they made just catastrophic decisions because they didn't have enough information. So I will try to ask as many smart people as I can find quickly, especially if I'm thinking about something that needs to be done relatively quickly, within hours to days. I'm going to find as many smart people that have as diverse a background as possible to help me think through what could go right, what could go wrong. I'll apply that to what I've seen over my career and then say, okay, this is where I think we should go. But I'm also not going to die on that hill. If I guess wrong and we identify quickly, we're going to pivot. I maybe sometimes pivot a little too quickly if I'm being my own performance review. I don't necessarily stick things through as far to make sure, but I also, if I see things failing, I'm not going to let them fail for a long time before we change course. So I will make a decision. I will keep an open mind. I will always monitor for new input. And then just try to go as fast as possible. But the worst thing you can do is not make a decision. When you just sit there and don't do anything, you're going to get clobbered.
Uh, so, in this IT leadership role, see, as effective decision makers, you also need to kind of look at the contrarian view, right? Because you are making some um, key decisions here. So, what is the contrarian belief that you hold, like which you encourage perhaps around yourself as well, like
Yeah.
people who disagree with your thought process? Like, how do you encourage and like what's the contrarian belief that you hold?
You know, it's important. I'm blessed with a team that has no problem with. They have no problem telling me they think I'm wrong, so I can get that contrarian view without having to ask too much for it. I have been in situations where people were disempowered, and so I've named the contrarian. I have a skill that I've developed. It's probably something along the lines of my risk aversion, where I can very clearly think through both sides of a problem. I can visualize what could go right, what could go wrong, what the probabilities are, with some degree of accuracy. Just because I've had a lot of exposure to a lot of things, and then with additional inputs, we can do that. So I can kind of be my own naysayer, maybe even too much. But the big thing is having people around you that know more about the subject than you do, and know that you'll support them if they say, no, that's a really dumb idea, that you're not going to just tear them apart. You're going to ask why. You're going to modify your opinion if they give you a valid answer. And you're going to support them for that. You're going to encourage that. You're going to reward them for that kind of behavior. And then that will breed more of that kind of behavior. And the more you model it, then that starts to show up in your line staff, where you've got a PC tech or a server administrator who will raise their hand and say, this isn't the right thing to do. We need to talk about it, and not wait for management to tell them what to do. Once you get to that point, you can be really effective as an IT organization.
Now shifting more towards the technology side of things. So, in your industry, what's one underrated technology or a trend that you see which is kind of redefine the way business is getting done?
That's very difficult. From healthcare as an industry, I think mobile technology is still very heavily underutilized. The applications that are in use are still very much client server applications. They run fat. They've tried to mobilize them by putting them on virtual servers or putting them on, Citrix or VMware virtual machines. Um, and it's clunky, it's difficult, it's time consuming, versus if the doctor could do most of their conversation on their phone or on a tablet that they can keep in their notebook, they would be so much more effective. But we worry about the tablets leaving the hospital, we worry about data being lost, we worry about effectiveness and efficiency, we worry about inputs and outputs. Um, and I think, especially now that AI is becoming more capable and accurate, that becomes less of a thing. Right now, I can actually just talk to my phone and have it fill out the form while I'm talking to the patient, and I can be so much more effective. Not so much an issue for me in my industry because we're ambulatory, but in hospitals, and even in some ambulatory, there's this concept of pajama time, right? It's the time after the day is over where the physician or the nurse spends another hour and a half or 2 hours typing notes into the device because the device is fixed. They can't necessarily bring the patient to the device. And so now they're going back through sticky notes. They're going back through all these notes they've scratched all over the place and trying to remember what's where. Whereas if we could give them a mobile solution that lets them interact with the EMR and place orders like DoorDash does, it helps them find patients like Google Maps or Uber does. Those are not complex. They're complex technologies, but they're not new technologies, and they're just not aggregated in a way that is focused on how do I make this doctor as effective and competent and happy as possible, because that all translates into better patient care. So that's I think probably the one area that most healthcare organizations have just not focused on because it's legacy security risk, it's applications that don't exactly fit the format, and it's a real limitation that could really move us forward, I think.
And as you were mentioning, now with AI and also people talking about the agentic AI part of it, like I know data security is always going to be a matter of concern, irrespective of whether it's AI or just the mobile application. But at least from the user experience part of it for the providers or the other stakeholders in the healthcare system, do you think that AI could actually um, bring the disruption, or like could actually be the wave of adoption for this technology?
To a point, I think especially in caregiving, you're always going to want a very highly trained nurse or doctor as the interpreter of that information. Now, the information coming out of the large language models is, let's say, 95% accurate. When they're going into surgery, I want that other 5% verified by somebody else. So I think there are applications for it. I think one of the more and more people are working on this, but one of the more underutilized parts or functions for AI is as a physician augmentation system. So as the doctor's putting information in, capturing symptoms, talking about it, thinking about it, putting notes in, the AI on the back end is constantly looking at saying, hey, I know you're not looking down this path, but everything you just described also looks like this. So it's not telling the doctor what to do, but it's saying, hey, I'm seeing a pattern here that might indicate that while you're focused on diabetes, it could actually be something else, lupus. It could be something else that, because you're kind of locked in on a diagnosis or you're locked in on a symptom, you're missing that there's some other lab that's elevated that would indicate a different solution. And so bringing that entire knowledge base forward as an augmentation of a professional, and we're talking healthcare, but you could do the same thing in accounting, you could do the same thing in auto maintenance. It applies everywhere. If you have something that can apply the entire body of knowledge and synthesize it down to you, you're going to be better at your job. And so I think that's where there's an opportunity to use it. We're trying to use it as staff reduction. We're trying to use it as an interaction system. I just don't think it's there yet, and I don't think it's safe yet. In our industry, trust is very important. We do addiction medicine, so understanding who you're talking to, understanding what their experience is related to yours, is very important. And I think a lot of our patients would reject any attempt to put AI out there as, okay, they've just depersonalized me. They care so little about me that they're not even putting a human with me. So I think you have to be situational. But if it's how do I schedule an appointment? How do I pay my bill? Those are great uses of the technology, assuming that your back-end systems will talk to it.
And not mostly from the consumer or the patient experience part of it, but from the doctor or the nurse practitioner standpoint of view, right? AI could be a great technology there.
Absolutely. There's great potential there. And a lot of the doctors are using it on their own. Even if the hospital or the health system isn't providing it for them, they're using, ChatGPT on their phone to ask questions. They're using Google Gemini to run a symptom through and see what all diseases might include this symptom, just to make sure they're checking all their bases. And so that's one thing I've found in healthcare is there's this reputation that doctors are resistant to change, which is absolutely not true, right? Doctors are resistant to unproven, untested change. If you tell them to do something just because you said so, they're going to push back. But if they see that a technology makes them a better doctor, gets them a more accurate diagnosis, gets their patient healthier faster, they will adopt it in a heartbeat, as long as there's an efficient way to do it. And so I think that's where we have to really change our focus, and it's less about look at this cool technology, and it's more about how do I make my doctors better than they are today.
Exactly. Yeah. I think that's a great point, especially, and that's probably not only with respect to healthcare, even with other industries, as you mentioned, right?
Mm-hmm.
Like, we straight away look at changing the customer interaction or the consumer interaction by bringing in the AI, but rather we should look at inwards and see how could you make it more efficient for the employees, or boost the
Yes.
productivity so that they can service their customers or consumers better, right? Rather than
Yeah, absolutely. Yeah,
because
well,
it's true,
especially as companies are cutting back on SG&A on those overhead services like HR, like legal, like compliance. They're having to focus their resources on the things that matter the most, and so they're not available to answer questions about insurance policies, questions about where documents are. And so using AI for that, particularly because people have become so much more comfortable interacting via chat windows or via text instead of a phone call, that's a fantastic use for that technology.
Right. Uh, Again, just going in more with the technology. So in 2024, what were some of the technology initiatives or technology adoptions that you saw which you had never done in the past? What did you build, something that you had not built in the past?
Yeah, well, for me, and it's 2025, and everybody's gonna be like, everybody's done that, but for me, I hadn't. So our systems are very fragmented. I have two EMRs, but I have 130 instances of one of them and 80 instances of another. And so what we built in 2024 was a data warehouse that pulled the information, starting with revenue cycle and finance, to give us an enterprise view of our business for the first time in the history of the business. And it's nothing special. It's not going to impress anybody, but it gave us capabilities that we never had. It identified and solved massive problems that we didn't know were there, and it's become now a tool that the business trusts. And so that's kind of when you get that vote of, your systems matter when somebody tells you it's down, right? If they're like, hey, the data lake's not available, okay, they're using it. If it's down for a week and nobody calls you, maybe you should work on something else. But that was the big thing that we focused on is really getting an enterprise data view. And in our case, we had to do it as inexpensively as possible because we're a low margin business. But we came up with some really interesting stuff, hosted out of Azure, running some Linux operating systems, and built some really powerful engines that can answer business questions. And the ironic thing out of that was that we finally taught our users how data governance is supposed to work, and it was completely accidental. It's like they're coming back saying, well, why doesn't your report match my report? It's like, well, because yours is in Excel and you changed the numbers. That's why they don't match. And so now we've got people understanding, using terms like source system or system of truth, and making changes in the source system so that they're reflected up through the data lake. And that's made us more accurate. It's made us more efficient. And we spend less time chasing anomalies and more time chasing after what needs to be worked on. So that's a thing I'm very proud of that we've built. It was new to me, and it really contributed a lot of value to our organization.
Awesome. So, so what's one of the most overlooked skill for CIOs that separates the good CIO from the great CIOs?
I actually had somebody tell me this the other day. So the big thing is the role of the CIO has become so much more complex because your other executives understand a little bit about technology and what technology can do. They don't necessarily understand how it applies to the business. So to the extent that as a CIO you can be a business person with a technology background versus a technology person that understands business, you'll be more effective. You have to understand how the machine works in order to be able to say whether a solution is going to work or to tune your system so that they work more effectively. And so, beyond the basics of being a good communicator, communicating, meeting people where they are from a communications perspective, you've got to understand your business. You've got to understand how the money flows. You've got to understand from initiation, from new customer through the last bill that's dropped, how does all that work, and really be able to speak their language, speak their acronyms, and understand that. And when you can do that, you get to talk about a lot more things than if you're just in there talking about speeds and feeds and servers and security. It's got to be in relation to something else. And so I think it may not be, it's an underdeveloped skill for a lot of technology leaders, particularly people who are early on in their career. They haven't maybe had a lot of exposure to board meetings or a lot of exposure to senior leadership meetings. And it's something you have to really be intentional about. You ask a lot of questions. Don't be afraid to look dumb. One-on-one, you don't want to do that in a board meeting, but ask those questions of what does this mean? Why does this mean? Why does this work the way it does? And then once you understand that, you'll have a much better idea of how your tech works.
Got it. So I know probably like when you came to BayMark, you might have had already a system that you got it over as a legacy, right? So and today, if you were to kind of rebuild your IT strategy from scratch, um, how would you do it? Like, how would you approach it? Very different from what you actually had to kind of take over.
Yeah, I got a little bit of a mixed bag when I came to BayMark. The person that was here before me had laid down very good foundations. Security was in a good spot. The help desk was functioning well. Inventories were good. And so I could focus on some of those things. I think what I learned is if you're new to an organization or if you've never done a strategy before from an IT perspective, you need to understand what the business strategy is. But what I found is that there was no way I could map to that because the system was so complex. So what I've started thinking about is in my IT strategy, year one and year two are simplification. How do I take out as much stuff as possible, as much redundancy as possible, as much duplication as possible, and get to a platform that can run fast. And a lot of people don't really think that is strategic, but if you're not designing your organization to run like a speedboat, you're never going to be able to match a strategy. And there's two things that happen. One, you fail to meet your business's needs, and the business has a problem, or you're no longer part of the conversation and the business goes out and buys it as a service or builds it themselves in their own department, and now you've got security problems, you've got data incompatibility problems, you've got more complexity because you didn't build yourself a platform that could run quickly. And that takes some political savvy, because for that to happen, you're going to have to take out some sacred cows. You're going to have to take systems that the CFO loves out because they're redundant and they're not as effective. But once you get there, once you get that speed, once you get that data, now your next focus is what is the business strategy and what are the technologies that amplify it? And then that's how I would lay it out. But the first 2 years, and even here, the first 2 years were, how do I go from 17 EMRs to 2? How do I get off of the legacy storage platforms and the legacy share platforms and onto OneDrive and M365? Once we're there, now we can go faster. Sharing information is faster. Connecting is faster. And adoption is faster. And so it was an important part of my strategy.
Awesome. And now in 2025, given all the other technology innovations that are happening, what are you perhaps most excited about, which you feel is more relevant for your organization, and where are you planning to kind of probably invest, or where do you feel that this is something that you need to do for
Yeah.
BayMark?
We're having to do some really basic operations, service desk change out, Windows 11 upgrades, Windows Server 12, 2012 upgrades. A lot of not very sexy stuff that is taking up a lot of our time. But where I'm excited is really amplifying the data lake that we've built, adding additional data sets, HR data sets, finance and time and salary information into it, so we can start to get operational reporting. And then in the second half of the year, we're really going to try to see if we can lay a large language model AI over the top of that. And really start to get to the point where the CEO or the CFO could just ask, Jeeves, or whatever we call our AI engine, questions about the business. What's my top performing clinic? What's my worst performing clinic? Which doctor sees the most patients? Which doctor sees the less patients? And have that engine work just like how you would use ChatGPT if you were trying to think about starting up a new business, or you were trying to understand a complex topic. Just ask it questions, and then contextually keep asking it questions. And that's something that I really think, if we can make work, is truly innovative and will move us forward well past our competitors, and probably well past a lot of other places in healthcare, because that becomes very powerful. Your time to decision I guess if that's IT's biggest role is to reduce the time to decision, that takes your time to decision down to, you know, instant versus, okay, go away for a week, give me a spreadsheet that answers this question, I'll give you the next question. This is ask a question, ask a clarifying question, ask another question, now I've got my answer. And it could literally be a half-hour chat.
Got it. Got it. So, you mentioned early on that you're a big believer in acquiring knowledge and stay on top of what's happening, right? So, where do you go out, or what are some of the forums, or where do you get the information and the knowledge that for you to be on top of things?
Okay. Yeah, Feedly is my friend. I go out and I subscribe to business business technology, business feeds, Dig and Lifehacker, and some of those technology and consumer technology, because a lot of times things will show up as a consumer technology first, and then I subscribe to several healthcare, modern healthcare and Becker's and things like that, where I don't have to read the whole magazine. It feeds it to me as a feed, almost an email, and I can choose which one I read and which ones I don't. That's been very effective for me over the last few years because it's giving me enough information to know what I should go look for. I have not played around with their AI to do summaries for me, but I absolutely will take their ideas or those websites and feed them into ChatGPT or Gemini and have them augment them for me. And try to think about how that might give me a solution to a problem I may not know I have yet. But for me, it's mostly about knowing what tools are available, not necessarily knowing exactly what they can do for me today. So I try to be intensely curious about what's going on and how to get into it. And I'll admit, I'm more focused on data and knowledge technology than I am infrastructure and virtualization. That's the stuff I used to care about intensely, but it's gotten so complex that it would take me too long to learn, and I really think the direction, particularly as an executive, is going to be how do I take data and turn it into information, and take that information and turn it into decisions as quickly as possible. And so that's where I focus.
Awesome. And are there any habits or mental models that that help you to kind of stay ahead in this constantly evolving technology landscape?
I wouldn't say I don't really think I have a specific mental model. It's just how I think about things. So I try to capture as much as possible. I try to if something catches my attention, I try to get a little deep on it quickly so that it's out there. And I've gone down rat holes like anybody else has, but it's about understanding the concept of it rather than understanding explicitly how it works or exactly what it'll do. Because I find that those ideas, by the time I have the ideas of how it might work, the technologists that drive those technologies have caught up to where I'm going, and now those capabilities were there. So that's really what I look for is, okay, what are the concepts, what are the constructs, and then what types of problems could you maybe apply that to, and think about things that way.
And so, what is the best piece of career advice you have ever received, Mike?
Network. I'm a terrible introvert. I'm not. I'm probably a little more outgoing than your typical IT guy, but I'm a terrible introvert. It's difficult for me to go into situations where I don't know a lot of people and mingle and make small talk. And so I had she was actually an employee, but she was also my mentor. She worked for me, but she was also kind of my coach and would kick me in the butt every now and then. And so the big thing to move a career forward is it doesn't matter how skilled you are after a point, right? You could be the most intelligent, smartest person on the planet. At some point, you're going to have to collaborate with other people. You're going to have to connect with other people. And so there's two parts of that. There's join industry groups. And go to those meetings, get to know those people, learn what they're doing, learn who they are, and then where I'm really terrible and I'm trying to get better is stay connected. Once you meet somebody, once a quarter, once a year, take them out for coffee, just catch up, make sure you know who they are as a person, not necessarily what they can do for you as a partner or as a vendor. But that's the thing that a lot of us, particularly on the IT side, don't harvest enough is, okay, you may have 1,500 people on your LinkedIn, but if you haven't talked to any of them in the last 6 months, you're doing yourself a disservice.
Yeah, that's really great. And what do you want your legacy to be as a CIO?
If I it's that he's a person that could solve problems, that identified, was collaborative, and was effective, right? That we found problems, we solved those problems, and we moved on to the next problem. I don't necessarily need to be a hero. I don't necessarily want to be the person that changes the world. But if I made the people around me better, if I made the companies that I worked for better, that's good. That's really why I do this, and what I hope to achieve out of that is he made us better. That would be, if somebody said that about me, I would be very proud of myself. So
Awesome. I mean, of course, like, creating better leaders after you pass on the
yes.
passion to them. I think that
That's an interesting idea. It's something I learned really fairly early on in my executive leadership. I worked for a large health system, and the then CIO of the organization was well respected in the industry, was a very smart individual. But if you looked in the community of CIOs in healthcare, he had generated no CIOs. There was nobody that worked for him as a direct reporter in his organization that were CIOs of even mid-sized hospitals or health systems. And it always struck me as that, especially at that level, when you're running billions of dollar company at that level with massive IT departments, you have a responsibility to put people back into the ecosystem. To it's kind of how they measure American football coaches. It's like you look at Andy Reid, and Andy Reid's original staff, there are like 7 people that are now head coaches, and so they admire him for that. I think that's the true test of a leader, is how many effective leaders have you produced. And so that CIO retired. His successor was my boss. My boss, I think, has 6 or 7 CIOs out in the world that are working in healthcare. And to me, that's a testament of talent identification, talent development, and encouragement. And so I think that's an important thing that we have to really think about is if you're at a big organization, even if you're not, how many of your technologists went on to bigger and better things in a way that if they said, hey, he worked at BayMark, that's automatically a check mark that says that's somebody we want, right? That's what you're looking to build, is a team around you that can be respected just because they were part of that team. And I think it's an important thing.
Awesome. And that's a great input. And if you could put a single idea on a billboard for all future CIOs to see, what would it say?
Air gap your backups. We had a little security fund last quarter, and the thing that saved our bacon was that we had appropriately protected our backups so that they couldn't get to them. And it took us from 6 weeks of downtime to 6 hours of downtime. And it's something that when I got here, I wouldn't have thought of it. If you don't come out of the server and administration space, you probably don't think about it. You're just like, you're asking, are we backing it up? And the answer is going to be yes, you are backing it up. Are those backups protected? Can those backups get encrypted? Oh, that's a different question. And so you really have to think about, at the end of the day, your job is to keep the systems available and keep the systems functioning. Everything else we do is gravy above that. But if the lights are not on, if the systems are not available, there's nothing to do. And in this day and age, with the threats we have, the transitory nature of the technology we have, being able to protect your environment is got to be job one. If my next CIO job, the first thing I'm going to ask for is, what is our security protection plan? The second thing is going to be, how are we backing up and protecting our data? After that, everything else you can figure out.
So finally, what books or podcasts or resources have had a profound impact on you?
That's interesting. I read a lot of self-development, self-help books. Um, the things that have spoken to me most recently are like Cal Newport's digital detox or digital minimalism. We get caught up, especially in IT, with, it's almost like a badge of honor. I got 600 emails today. It's like, okay, but you didn't do any strategic work then, right? So, looking at ways to really make yourself effective, how to stay, I have organizationally induced ADD just like everybody else does. I forget why I opened the email because I've already switched to my next task. So working on things like that that allow me to focus, bring myself in, do meaningful work instead of getting. If I get a lot of things done but none of it mattered, I didn't get anything done, right? And so that's the retraining of my brain into those types of to break those types of habits, and that dopamine hit you get from, hey, my inbox is empty again. Okay, but you still haven't written your strategy. You still haven't developed your training plans. And so really focusing on, okay, what matters, what has to get done, what am I gonna let go, and then yesterday I actually learned some tools in Copilot. So now I've added to that, what tools are you going to use to make you more effective? There's a tool in Copilot that'll summarize your entire inbox for you in one sheet. I'm not going to spend time in email anymore. So
Right, right. And if you could have dinner with any historical or a modern leader, who would it be and why?
I would love to spend time with Warren Buffett, just because I think he thinks about things differently. From a technology perspective,
Yeah.
maybe Steve Jobs.
Okay.
I think he would drive me crazy, but I would love to just pick his brain for a minute. His ideas around it's really hard to make things simple resonate with me. His drive for quality and uncompromising drive for quality is something I think we let go in the name of speed and efficiency. So understanding what made him think would be interesting. Not that I'm an Apple fanboy, but he had interesting ideas that aren't really replicated in a lot of at least American businesses right now.
And finally, if there are points which I have not been able to kind of cover, or you would want to kind of share with the aspiring tech leaders, is this something that you want to kind of share?
I would say to the aspiring technology leaders, don't wait until you think you're ready. Don't wait until you've earned the opportunity. This was something I struggled with early in my career. And it was actually my wife who was like, you know more than you think you do. Take a chance, take the role, apply for the job that you think might just be a little out of reach. Give yourself credit for what you've done. Be rational and realistic. You want to be successful, but you know more than you do. You're ready. You're more ready than you think you are. And then I would also sit down and do a self-assessment. Okay, what skills am I missing? So based on what we talked about today, I need networking skills, I need critical thinking skills, I need business skills. What of those are my weak in? And how do I strengthen that? Do I take a class? Do I take a finance class? Do I go to HIMSS or a SIM or one of the IT leadership groups around town? And learn to network, find somebody who's good at it, mirror them, see what happens. But take control of your career and don't wait until you think you're ready. You're probably ready. You just gotta take the chance and do it. Be effective.
That's a great piece of advice. And where can people connect with you or learn more about your work? If you are comfortable with in connecting, where should they reach out to you?
Yeah, LinkedIn is probably the most effective way to reach me. I do try to get it cleaned up, and we all get the flood of people coming at us, but that's a place I try to connect to at least every week and make sure I'm responding to people who reach out to me. You can find me online. I don't have a huge social media presence. I found that it was taking away too much time. So LinkedIn is probably the most effective way to get me, and I do monitor it and I do respond.
Awesome. Mike, it has been a pleasure speaking with you. Thank you so much for taking out your time and connecting with us today. Thank you so much. Deeply appreciate it.
Thank you. This was fun.